Hello, everyone, and welcome to Quinnipiac University's Instructional Design Programs webinar series. This is our Spring 2026 webinar series, and it is March 31st. We are very excited to have Trisha Pitter from UConn Health talk to us tonight about the intersection between instructional design and healthcare, and talk a little bit about her journey and the types of work that she does in those two overlapping fields. So we're very excited to have you tonight, Trisha, and we look forward to hearing what you have to share.
Awesome. Okay, so let me just queue up and share my slides. Okay, you know what? I've been on Teams all day. Okay, so it's Zoom. All right. So let's do this. Can you see my notes?
We can see your presentation and not your notes. So you are
Wonderful.
good. Yes.
Yeah, so yes, thank you for having me. I'm so happy to be in this space with you all. To talk about my journey into the field of instructional design and the twists and turns along that journey and how I got to where I am today. Okay, so I'm just going to reintroduce myself because it's part of my slides. So, my name is Trisha Pitter. I go by the pronouns she, her, hers. I am the director of community learning and engagement, and I'm also an instructional design specialist. I work at the UConn Health Disparities Institute. And just a little bit of background about the Institute. It was established by Connecticut law in 2019. And our mandate was to, or is to, eliminate health disparities and advance health equity across the state. So that is very general, but it also is a good thing because we can be creative in so many ways as possible. So, my pathway. So, like many of you who are instructional designers or who are in this graduate program, I did not come into instructional design through a traditional pathway. Um, I was asked to develop learning modules before I even had any type of formal training in the field. And it felt like trial by fire. I remember feeling both excited and a little bit overwhelmed. I knew that was doing something that was impactful to the work of health equity, but I didn't have the preparation to fully support that. So that experience pushed me to seek formal training, which led me to the CDC e-learning institute. That institute was a 6-month online fellowship for public health practitioners. And I was introduced to similar core theories and models that you're probably already introduced to and have also utilized in your own practice. So, like from Addy to Bloom taxonomy to adult learning theory, Gagne, events of instructions, action mapping, and so much more. So while I knew there was so much left to learn, I left that experience, even though I felt grounded and confidence that I had the clarity to build like amazing learning products. I left that experience feeling that I did not have the appropriate models to create learning experiences or products for public health, healthcare settings, health equity settings. And I quickly realized that I had to move beyond what I learned and that I had to respond to people and contexts and systems shaping their experiences. So, a little bit more about the UConn Health Disparities Institute and our approach. So, the way how we work is that we bring together research, policy, community engagement, and systems change. And we do this in partnership with communities, specifically communities that have been historically marginalized and medically underserved. So the question for me became, what does instructional design look like when it's practiced in public health, health equity, and justice? So, in real world public health work, things typically, or healthcare work, things do not typically, aren't typically linear, right? What I've experienced over the years is that interest holders' priority shifts from time to time, even while you're in the project itself. Timelines continue to shift and move. And what's really important is that trust shapes whether people participate or partner at all. So, in addition to learning, um, I think of learning as something in this space as something that's bigger than just a course, a toolkit, a module, an infographic, a fact sheet. I look at it like it's community engagement, clinical practice change, systems transformation. So while I think analysis is very important in the beginning, it doesn't need to always happen at the front end. It can always continue through the work. So, my design approach, which I have adopted for everything that I do, is I use a participatory approach, which means I design with people and not for them. A participatory approach means the people most affected by an issue help shape the learning, the process, and the decisions, not just receive what has been designed for them. So it means recognizing lived experience as a form of expertise, creating conditions where people can contribute with safety, dignity, and agency. And in my role in practice, that means I have to pay very close attention to relationships, building relationships, maintaining and sustaining relationships, building on existing assets that are provided from community members, and also participation, and to always be mindful who is still missing from the conversation. So, an example of this approach in practice is the Menopause Equity Initiative. This is something that the Yukon Health Disparities, it's one of our biggest priorities right now. And it is a statewide effort advancing access, awareness, and equity in menopause care. And it involved collaboration across community members, clinicians, researchers, educators, and partners working in different parts of the system. And of course, like many of us who are either going through the menopausal transition or even providers, there is limited information. There is a lot of misinformation, but we wanted to make sure that there were conversations that were happening around menopause. And we knew that we wanted to deliver some type of learning product. So let me tell you what we did. So we started by understanding the context of menopause, right? We held an inaugural event with the Commission for Women, Children, Seniors, and Equal Opportunity, which is a state agency. And we screened this documentary called The M Factor, Shredding the Silence on Menopause. And it was the first documentary film that addressed the marginalized or ignored health crisis faced by millions of women as they go through this natural biological transition. So through this initial engagement, and this engagement was actually held at the Legislative Office building, we there were over 100 people in attendance. We had some men in the audience. And we also had healthcare providers or experts who were part of the panel. So, through this engagement, we gathered information about lived experiences that people were so open to share. They talked about their access to care. They talked about their knowledge gaps, the knowledge gaps of their providers, the barriers, the strength in convening in this room, knowing that they do not have to, this is not happening just to them and they're not going crazy. And what became clear was the context was not just clinical, right? It was personal, interpersonal, community based, structural, and policy related. So we were not asking people information about what do you need. We were asking them, how are you navigating this? And after we gathered all this information from the event, the constant thing we heard and saw was, how do I create a plan for when I go to my doctor's office? What should I be saying? How should I be saying it? When do I say it? Who do I say it to? So we were like, okay, I think we're ready to respond to these needs. So initially, we decided the plan was to build a toolkit, like a develop your menopause care plan toolkit. And we were still having events, and we were in different spaces, engaging with different communities and providers and policymakers. But as we continued listening, it became clear that the toolkit was not going to address the deeper needs that people were naming, right? So we paused, literally, we paused and we shifted our approach. And the experience reminded me that good design is not about building what you planned, it's about responding to what people are actually telling you, right? So what people were telling us was that this was a deep rooted systems issue that a toolkit could not fix, right? We were thinking short term, we need to be thinking long term, and we need to be thinking sustainability and scalability. So as a result of this, we thought we need to create or convene a collective, which is the Menopause Equity Collective, in response to the need for the community, right? And it needs to be community driven, equity centered, right? Approach to menopause. We wanted to make sure that we would elevate the voices of those most affected by women's health inequities in Connecticut. And the MEC is a central component of the Menopause Equity Initiative. So they were helping to supporting the development of the priorities, outreach, education, community-led action related to menopause awareness, care, and policy change. So these are our collective members. We have about 15. I don't think they're all represented in the photo, but we have 15 intergenerational, multilingual, multiracial, multisectoral members representing research, private sector, public health, healthcare, community, and we also have some students in there as well who are not even in the menopause transition, but they're very interested about the topic. So, and those students are actually Rising is a dental student candidate, and one is getting her master's in social work. So by creating this space, so we created a space for shared ownership, co-planning, and actually true partnership, right? We shaped the priorities at the community level, the structural level, the institutional level, and the policy level, and we guided what happens next together. That changed the design process itself because the work was no longer something being delivered to a community, it became something being shaped with them. And remember what I said earlier, we design with, not design for. And so those closest to the issue are closest to the solution. And I would say 90% of us in that picture were in the menopause transition. So we were definitely closest to the issue and the solution. So as the work continued to move forward, it became a continuous learning loop, right? We had more events, we listened, we gathered insights, we evaluated what we were hearing and seeing. We always shared back what we learned back to the community and those who provided insight and input. And we reflected with others and we adapted the design, and it always continued. It kept going and going. So at that point of engagement itself, it became a form of learning. When we were co-designing, we were trying to meet people where they are and respond to what they needed in that moment. Sometimes that looked like screening of the M Factor documentary, and sometimes it looked like shared learning or having conversations or storytelling circles, continuing education, because we did provide some provider education, where we did provide continuing education credits and even a party. So we actually last year in October for Menopause Awareness Month, we literally had a party. And it was called Power of the Pause Celebration. And we wanted to shift the narrative, but also shift the perspective of what it is to go through a menopausal transition and a woman in midlife. We always hear like these horror stories about menopause, and we said, you know what, let's shift it. Let's shift narrative and let's shift behavior and let's shift perspective. And we did that through a party. And you can see in the picture up at the top left where it says the Power of the Pause celebration. This was a panel of multidisciplinary providers, and they were having conversations about this topic. They were sharing with each other. They were co-learning together while the audience was learning as well. And they were also finding opportunities of how they can cross sector disciplines. So we definitely created an experience right there. And learning was taking place, right? It was happening naturally and organically. And I just wanted to say that each engagement, it became intentional, relational, and a flexible part of an ongoing process. And we were continuously identifying themes and using what we've learned to build towards a system of transformation and basically build this huge moment and movement in Connecticut. So the results, which I'm so excited about. So we're coming up on a year. I cannot believe it. It's almost been a year. And it's definitely been an exciting one. And we used all those voices and lived realities and datas and themes and what we've all heard. And it actually influenced two bills this legislative session. So there's Bill 5389, which ironically is for a toolkit. It's for a provider toolkit. And then Bill 353 is for workplace accommodations for related to menopause. So our Menopause Equity Collective worked closely with legislative representative Kai Belton, who's championing menopause equity in the state of Connecticut. And we sat down with her and we basically framed the language for these bills based on what we learned, based on what we heard. And we made sure that every lived reality or every lived experience that we came across that was shared to us, that we were able to make sure that they were reflected in every piece of language in this legislation. As a result, also, we all testified. So some of our Menopause Equity Collective members provided testimony, either written or spoken. And also some people who we've never even engaged with also testified on these bills and named that the UConn Health Disparities Institute was creating this moment and movement. So again, what started out as a learning toolkit product, actually it transformed into that we were influencing and changing systems at the policy level. And that was big, right? Just by changing our approach. So I also want to share with you just briefly how this also shows up in like youth programs. I did a youth participatory action research program, and we use photo voice as a method. So in this project, and these are our, at the time, I think it was like a year and a half ago, and these were rising ninth graders. So they just finished middle school and they were going into high school. And we worked with an agency called Waterbury Bridges to Success, where they provide academic enrichment programs to students who otherwise wouldn't have gotten the opportunity to be in programs like these, right? So what we did at HDI is that we said, you know what, let's build a youth participatory action research program where we actually train youth to lead in research based on their own lived experience and based on what they saw in their communities. So in the beginning of this project, we really didn't start with analysis, right? We began with conditions, and we wanted to, and a condition of that is to create an environment where youth can build trust, where they can lead, where they can establish group agreements, where they can identify issues that they cared about and analyze them together, and co-create solutions. And we felt like we needed to do that first. And once we did that, we trained them in photo voice, research ethics, analysis, and storytelling, and they led the inquiry. So each day looked different. They designed what their day would look like each day. We just built the environment for them to lead and learn and thrive in each of those days. And you can see some pictures down here. Hopefully you can see them, and what they're doing. And then for the next slide, are there photo voice projects. So photo voice is a research method where you use pictures and storytelling to capture problems or or inequities in your neighborhoods or in your communities. So you take pictures, and through those pictures, you put together like some people might do word clouds, or some people might do poems, or they might write a statement. But these are the different types of projects that they worked on, that they led, that they decided on. They put it all together. And as adults, we stepped back. We actually trained some peer leaders who were close in their age to facilitate, but not to instruct. And we made sure as adults or HDI in the room that we weren't enforcing adultification, that we were making sure that they were at the highest level of youth participation, which means shared decision making, youth initiation, and adult sharing. So as a result, this is all their great posters. And we had an event where they presented their posters to the community, to their families. And it was something that many of them have never, ever done. One of the things that I'm really proud about from this program, when we're talking about transforming systems, is Lino. So Lino he was a participant in the Health Equity Scholars Program, and he always wanted to be an engineer, and he thought that he could never be one because of his environment. And he was able to present at a National Junior Science and Humanities Symposium because we built the environment for him to thrive and believe in himself and have confidence. And here's a quote from his sister. And here's some information about the STEM program. But this is a quote from his sister that says, this great UConn health program gave Lino a boost of confidence. He's a whole new kid. It has changed his whole outlook on his future. Kids in Waterbury don't get a lot of experience like this. We really appreciated it. So I am going to end this presentation with Paola Freire. I don't know if many of you know him, but he's a Brazilian educator and philosopher whose work revolutionized education, particularly in oppressed communities. So this is a quote that we usually use normally in all our presentations, and it's also a quote that we use when it's guiding our work. No one educates anyone else, nor do we educate ourselves alone. We educate one another in communion. So what this means is that we don't deposit knowledge into passive learners, right? Instead, education is a dialogue, is a reflection, and is an action towards social change and justice. So what does this mean for instructional designers, especially instructional designers who are very interested in going into public health or healthcare? It means your role can expand beyond the traditional context of building learning products. You can find yourself facilitating, building relationships, designing conditions for participation, navigating complexity across systems, building coalitions and collectives, helping to pass legislation. Like, there's so much work that an instructional designer can fit into the space of public health and healthcare. Um, so sometimes this product is, it's not always a formal course. Sometimes it's a process. Sometimes it's a long process. Sometimes you have to be flexible. But knowing that sharing experience and co-designing with community is a structure that can help people learn, act together in partnership, and also for sustainability and scalability. Thank you. And if you have any questions, I'm happy to answer them.
That was awesome, Trisha. Thank you so much for sharing everything with us about your journey and about these projects and all the work that you're doing with the important communities in Connecticut. It's interesting because you shared like both working with the youth and then working with, women and people in middle age. So you have kind of the whole spectrum of ages that you're helping.
Yeah, and I do want to add, because I didn't get to put this in my presentation because I wanted to be mindful of time. I mean, there's so many other projects that I can talk about. There is this one project where I was working with a nurse, and it was a nurse from the Connecticut Children's Medical Center, and she wanted to build she called it an app, but it wasn't an app. It was like a short course module, but she wanted it to feel like an app for parents who had anxiety for when their kids get oncology scans, right? Um, and it was really fascinating to build with her. She was not very familiar with how instructional design process works. We did not use Addie. We actually used SAM. We used that instead. But the process was very enlightening. I learned so much. I don't have to be a subject matter expert in this space, but one thing I did tell her was that we are co-designing this together. Like, you are going to be at every step of the way. You are going to have input. We are going to be sharing in this development together. And we were able to create a beautiful project. The modules, or the learning product, is on YouTube, and she's handling the dissemination of it to parent and caregivers. And yeah, it was a very exciting project. And just one other project where I can tell you about the possibility of what something else would look like in instructional design. I worked with another nurse. It seems like nurses are very interested in research, but I worked with another nurse at CCMC. She was a pediatric oncologist, and she wanted to create um, modules for providers to talk to adolescents who are cancer survivors around sexual health. So we built a number of modules. She wanted it to be very interactive and feel as close to as if they are in a clinical setting. Um, and again, we were co-sharing, co-designing it together. And she wasn't really familiar with the process. We did use Addie for that one. She wasn't familiar with the process. But what was so fascinating about that was that after it was done and she piloted and tested it, we were able to author a paper in a very popular journal for pediatric oncology. So that is also something that could come out of ID work, especially in public health or healthcare. You can be published, and your work can be published, and your methods can be published, and how you and what your design, what your process or your approach is.
I think that's really helpful for expanding the understanding of what this type of work can look like. Alex or Marcia, do you have any questions? I have some questions, but I would defer to the two of you if you had anything that came to mind. Marcia is coming to the end of the instructional design program and has a stronger computer programming background. And Alex is a nurse, currently just graduated from Quinnipiac last year, right? A year ago, and is working as a nurse and also coming to the end of the master's program. So, do you have questions?
Congratulations.
Yeah, two of my
No,
star students here tonight.
no, I don't have any questions, but it's just like it's a lot. Like I feel like this fits really well in the social and cultural class that we took, with the
Mhm.
emphasis on the learner and then the setting the social scene before the analysis even. That's what's it's really interesting to see, you know, this the way it played out for you.
Yeah, congratulations on that menopause project. That is incredible.
Yeah, thank you. Yeah, I mean, I've surprised myself too. I didn't know it was going to end up like that, but it did.
It's fun
So
to see how yeah, how it would start and then evolve in different direction. You know, each project kind of evolved in a different direction.
Hmm.
actually, I do have a question.
Yeah.
As you go through that project with the different, conventions or whatever, where they're watching the movies or having the discussions, how do you, I mean, do you document like your learning objectives at different phases and then they change at different phases, or do you, I don't know, I'm just
Yes.
curious.
No, that's good. So, we threw out the learning objectives
Yeah.
because every convening was different. Every objective was different. So what we did was instead gather themes, right? And I think that we would probably go into more of like the objectives when we start to build the provider toolkit. If this bill does pass, and of course, this it all takes money, right? And I think that was also one of the reasons why we paused because we didn't have a lot of money to spend on it. So I'm glad um, that the state congressional leaders are seeing that there is a benefit to this. But yeah, at that time, we were just being very organic with it and just listening and just identifying thematic areas. And I guess to build enough data and enough responses to say, yes, this is what we need. And based on what we've gathered, this is what it would look like. And these are the learning objectives.
I have a question about this sort of like participatory design approach. So I haven't talked about that in my own courses. I don't know, you guys would know better if you've heard about that in other courses, but I'm not sure it's something we really get into. But what are some strategies? So you talked a lot about building trust in the people who you're engaging with in the community conversations. What are some strategies that you use to build trust and also to get just people to share their stories and feel some ownership and like it's worth them sharing their experiences with you, and some ownership over the project.
Yeah, I think what was really important for us is that we did not enter spaces where we felt like we were the experts. I think when community sees institutions coming into their spaces, is that, oh, you're the expert and you're going to tell us what to do, right? And we did not do that at all. And we actually showed up where they were, right? We went into their communities, right? Their places of worship. Like we didn't say you have to come and meet us where we are. We went and met them where they were. And I think what's also really important is in building trust. It takes time, right? It's not going to happen immediately. It takes meetings. It takes even like meeting offsite. Like, hey, do you want to have coffee? um Let me go to an event that you're doing, right, that's aligned with the mission of our work. Let me see how I can support you in ways or another, or either bringing them in as let's partner on this together, right? Like for instance, tomorrow we're going to be having a menopause equity roundtable at the legislative office building, and one of our MEC members, who is affiliated with the YWCA of the Hartford region, she's doing this event, right? And it's on menopause equity and it's under the Menopause Equity Initiative, and they're taking the lead. But as trusted partners, we say, we'll provide you with information, we'll pay for the lunch, we'll identify speakers. We build trust with one another. And I do also want to add that with the M Factor, because the Yukon Health Disparities Institute, we do have a license for the documentary. We share it with community free of charge, right? So not only with trust, but we also build transparency. We say what we're gonna do, and we do it. And I think that also builds trust.
Yeah, it's really interesting, this conversation connecting to the two previous webinars that we had this semester that talked about using AI and some of the impact of AI on the work of instructional designers. And what's really interesting is that that hasn't come up at all in this conversation, and that the things you're talking about are things that can't be replaced by AI, that building the
Right.
relationships, building trust, building community, you
Mm-hmm.
might be able to turn around and use AI to churn out content, but
Mm-hmm.
in order to really get the usable information from your community, you have to do the work and build the relationships. So
Yeah, absolutely. I mean, I can share how I use AI in my work. I use it for workflows. I use it for even like either setting agendas, or I use it for building scenarios. I use it to help with content writing or content curating. However, with AI, of course, there are mistakes, and especially in the work in the field of health equity and healthcare, we have to really make sure what we're putting out there isn't causing harm. And we always are transparent with when we are using AI.
yeah,
So people are very much aware. Recently, we have been talking about how to put together an AI plan in our work, so we know what the boundaries are and the non-negotiables, and how we would use AI when developing programs and initiatives, and make that transparent to the communities that we work with.
yeah, that goes to that trust issue. Like you said, you can't rely on it to create content or things that then go
Mhm.
out with bad information because it damages the trust that you've put in the human work
Yes.
of building.
And it causes harm, and we are
Yeah,
trying not to cause any
that
further
right.
harm. Yeah.
The opposite, yeah. Any other questions, Marcia or Alex? Anything that came to mind?
And I'm happy if you would like to share some resources on like on YPAR, Youth Participatory Action Research Work. I'm also happy to share some information on participatory work with community. It's called CBPR, Community Based Participatory Research. My director, Dr. Linda Berry, she is like an expert. She actually brought this work to HDI, and I've just been building on that approach. And I know that she would be happy to talk to anybody about it. Um, but yeah, I'm happy to share whatever resources that I have that I think would be helpful to anyone. Um, yeah, just let me know.
Thank you. Yeah, it's really interesting, and I'm hearing more and more. We're having more, I think I've told you, but more students from nursing come over to take our classes, more students from the med school. So the overlap between instructional design and the healthcare field, it may have always been this visible, but it's becoming more and more visible to me, certainly. So I really appreciate you taking the time after a busy, yes, it's only Tuesday, a busy
It's
Tuesday. This is
only
only
Tuesday.
Tuesday. That's all right. Next time
No.
we wake up, it'll be Wednesday. So that's an improvement.
Love that.
Um,
Yes. No, I'm happy to be here. I again, full circle, right? I
yeah.
was in your shoes as master's students. It wasn't for this program. I got my degree in electronic media, which I think now is interactive communications.
Yes. Yep.
So, yeah, so I think I wish there was an opportunity for someone to come and share like what their day-to-day practice looks like in the field that I'm interested in. So I am just happy to be here and give back.
Yeah.
And I'm happy to be a resource for anyone that needs it.
Thank you so much, Trisha. It was wonderful to have you. And thanks, Marcia and Alex, for coming out on a busy night or a busy morning for Alex. So um, I am going to stop the recording. And if I can figure out Zoom changes things every single time I come here. Okay.